Hi, today I'm going to be talking about concussions and our response to athletes who get concussed. So, a concussion is an acute injury, and an acute injury is an injury that happens suddenly. Some common mechanisms of this injury are direct impact to the head, sudden acceleration and deceleration, penetrating injury, or blast. Some common signs and symptoms are headaches, nausea and vomiting, dizziness or balance issues, and being bothered by light or noise. In the inflammatory response phase, the central nervous system involves the recruitment of neutrophils and monocytes to the site of an injury in an attempt to aid the injured tissue via the secretion of cytokines and other signaling molecules. How can we assist the healing process in this phase? Rehab is the best thing to do in this situation, and just to have the athlete get some rest and be out of the sports environment. Some outcomes we can expect the pain to lessen slightly, but the athlete would be in a considerable amount of pain. In the fibroblastic repair phase, the body begins to repair and regenerate damaged tissue. To assist the healing process in this phase, you would still use rehab and rest because the injury is not 100% better at this point. In this phase, some outcomes we can expect the athlete to feel a lot less pain and to begin to feel more normal again, less headaches, less irritation of lights and sound. In the remodeling phase, some tissue responses we expect is that this would be the final phase of the wound healing and the collagen synthesis in order to strengthen tissue. How can we assist the healing process in this phase? Taking it easy and not going as hard as you usually would, as you are still technically injured, even though you might be feeling a lot better. During this phase, we can expect the athlete to be feeling pretty much normal, feeling almost 100% better in this phase. You may still have some irritation to light or sound or headaches, but once again, you're not 100% normal, but you're almost there. Some risk factors with this injury is permanent brain damage and headaches and migraines. Athletes can prevent this injury in the future by wearing correct pads in collision sports, being careful, and just paying attention to your surroundings. Of course, you can't avoid 100% of all injuries, but there's always trying. And something interesting or strange I learned is that at least 25% of concussions suffers to fail to get assessed by medical personnel. And as a cheerleader myself, I recognize some of my friends who have gotten concussed and they didn't have it checked out for a while and they were out for a lot longer because of it. So just if you have headaches and you hit your head or you don't feel good, just get checked out by a doctor.